Hi everyone, I'm Dr. Mkulise online, and thanks for watching this video. This is basically a launch of my online practice. I'll be doing quite a lot of talks around a lot of conditions, but today I just decided to start with common killer conditions or common killer diseases that affect women. And as you know that all of us would love to live a very good life, a very healthy life with our loved ones. No one would like to see any illness or get sick or eventually dying from any condition. The conditions that I'm going to present, like any other condition in life or any other disease in life, most of the conditions are preventable. They are also treatable. And the only thing that we rely upon is the high index of suspicion and early detection and treatment. Any delay with most of the conditions can simply mean severe illness and ultimately death. And I'm sure nobody wants to see that. The first one that I want to talk about is the breast cancer. And this is very, very common. And it's very scary because once it is established, usually it's a one-way trip. Very difficult to recover from the breast cancer. And yet it's very easy to pick it up. The only thing is that a woman needs to be trained how to palpate the breast or how to touch the breast and press it and feel if there's any area where there's a lump or area of hardness or any changes around the breast. And also there is a test that a woman can do called a mammogram. And to know more about that, I will be doing, of course, many discussions or presentations on various common conditions that affect women. And I hope that you guys will be joining me in all the topics that, in all the topics that I'll be presenting on various conditions that are affecting women. Of course, if there's anything that you would like to know, don't hesitate to visit our practice. I will give the details at the end. The other cancer that is very serious is a cancer of the cervix, or what we call cervical cancer. Generally, people call it a womb cancer. And then you see that picture, it should not bother you. It's a picture that will easily be understandable by a person who's medically inclined. But this is basically where the cancer starts. This is the area called the cervix. Shouldn't bother about that. The main thing is just to visit your GP, and the GP should be able to discuss these things. There's a test that we usually do. We call a pap smear. And there's also another test that we do where we pick up the papilloma virus as well. But all those things can be discussed in a GP's office if you visit your GP. The one worrying thing is the HIV. HIV is still a problem, despite the fact that government has invested billions on education on HIV, but we're still seeing a rise of infections. In fact, we are getting about 120,000 new infections every year in South Africa. So this is worrisome because there's quite a lot of education that went into HIV. However, we still see a lot of infections. But anyway, be it as it may, should you actually have one of the symptoms that I've listed here, please don't waste time. Visit us. We'll do a test, a simple test, and we'll tell whether you're positive or not and educate you about how to handle the condition moving forward. Diabetes and hypertension, ushukela, what they call the sugar disease and the blood pressure disease, high blood pressure. The sugar disease is called diabetes. This is a very, very dangerous condition because this condition, if it's not treated, it actually complicates. In fact, it complicates, it progresses even with treatment, but it needs to be properly controlled for it not to cause the damages that it can cause, because it is a systemic disease. So the only way to pick up diabetes is to do the sugar test, what we call hemoglucose test or sugar test. You can do that at your GP's rooms, or you can actually ask your GP to teach you. We can teach you in our practice in Davidson. We teach how people can test themselves, and we teach them everything about diabetes. Because remember, a patient must know everything about diabetes and know it even better than the doctor, so to speak. And if the diabetes is out of control, the picture that I've put here is showing the soul of the foot and how diabetes can progress from just a small lesion to a point where actually you lose the entire foot. And if it's on the leg or any other part of the body, you can actually lose that part because it's very difficult actually to control it when it's at this stage. So please, the only way of preventing this stage is just what we call a high index of suspicion, early detection and treatment. And the only way you can do that is always to discuss with your doctor and find the ways and means of picking up your diabetes. I will be doing a lot of talks about diabetes, and I'm sure you guys, you won't disappoint me. You'll join me in my online practice, support it because this is one way of actually educating the public, making sure that people actually live a healthy life and they stay safe. I'm sure you have seen people walking around with a face that is flat on one side and the mouth is lifted on the other side. Usually, this is a result of uncontrolled hypertension, that is the blood pressure. If the blood pressure is too high, it can cause problems like this. It's not the only sign, I mean, it's not the only condition that would give you something of this nature where you see this lifting on one side of the face and the flattening of the other. There are other conditions that I will discuss at a later stage, just to make sure that you understand. When you see these things on your relatives or on your neighbors, you should be able to understand what is going on without you necessarily being a doctor. I'm not going to try and make you guys to become doctors, but at least I want everyone to be aware of the things that are going around, especially I'm talking about the health issues. And of course, I'm showing you faces of men here. There's a face of a woman. It's just wanted to show you as diseases that affect women, they also affect men. But the idea is to show you pictures how these people look like. And of course, with the support of a woman, a man would, like you see, the gentleman here, he had a stroke and his wife is supporting him. Actually, is on his way towards recovery, although we know that there won't be any full recovery. However, he will eventually be able to walk around and assist himself and do certain small things in the house. Again, guys, let me go back to the slide. Hypertension, guys, hypertension. This is a very, very common condition. In my practice, I see every third or fourth patient in my practice has got uncontrolled high blood pressure. And I've seen a lot of strokes on young people. I've seen a lot of strokes on. I lost about 3 or 4 friends just on stroke. You know, I mean, I'm talking there are people the age of about 40, 45 these days. In fact, I see young people at the age of about 27, 28, already they have hypertension. And I can tell you now, it's the lifestyle. These are lifestyle diseases because of the diet and people are overweight. They are obese, actually. Even young people are obese these days. They are fat, so to say. So, guys, let us be serious about this. Contact me. I'm online. I'm available online. I'm going to give you the details at the end. So don't find yourself in trouble with conditions that can actually be prevented, and they can also be treated once they are established. Osteoporosis, very common on women. As you know that the women, they always have this fluctuation of hormones. In fact, as they grow older, it's even worse because they actually decrease their hormones and they then end up being susceptible to developing osteoporosis. And they would now present with a backache and all sorts of things. And all these things, they can be prevented, and if established, they can be treated. So please don't hesitate, call us. Mental health. I just discovered just recently that mental health has actually risen to about 17 million in South Africa. 17 million people in South Africa have got mental health conditions. And this is scary because it's just below a third of the population. And as we know that mental health can lead to devastating results. Some people can actually die mysteriously and others commit suicide. So some of the symptoms, I've put them here. And for instance, if a person feels like sad, you know, feels miserable, you feel like discouraged, you know, just unhappy, please don't hesitate. Visit your doctor, discuss this thing, and we'll be able to send you to a relevant a, specialist. Guys, everything can be treated these days. Pregnancy-related complications. These days, there's no reason why people should still be losing their lives due to pregnancy-related complications, or why, for instance, they should lose their babies. We have a very sophisticated healthcare system in the country. I mean, both, to be honest with you, both public and private is doing well when it comes to these conditions. The only thing is just, of course, you need a doctor who's going to pick it up and assist you. Fertility problems, many women, many couples, they have this problem. And they usually, especially in our culture, we sometimes think that it's only a woman who comes up with a problem like this. And sometimes you find it both of men and the woman. You find that actually the problem is on the male side. It's actually the woman has got no problem. So it's better that if both partners consult, and we can assist both partners. These days, we have the solutions to every problem that has to do with childbearing or making babies, so to speak. Bleeding problems, ladies, they know better about this, and it can come from many sources in the womb or in the cervix. Please don't hesitate. Always, whenever you see something bloody or blood coming from anywhere in the body, in particular here I'm referring to females, of course. They usually have this PV bleeding, or what you call vaginal bleeding, and then they can actually consult and can be able to assist. Like I said, all these conditions are preventable and they can be treated as well. We only rely on a high index of suspicion and early detection and treatment. And the only way is to screen. In our case, for instance, we're available at 2285 Sakona Street in Davidton. And you can always make an appointment at Jobe code 8457897. We also have online consultation. In fact, I'm excited about this online consultation because it gives me an opportunity to educate the society, to talk to many people, even people very far from where I am. I can be able now to actually educate them and discuss with them their medical conditions and be of help, even though they are very far and we've never met and there's no chance that we'll ever meet. The number is 0662582262. All you do, you save this number and then you go to your WhatsApp and then you can type hi or type anything and send. Then it will give you an automated response and then it will take you through to our website. When you get to our website, and then you register there. You open a file, you register, give us all the information. You can register yourself, register your spouse, you can register your children. You can also open a medical savings account right there. And the nice thing is that if you want, you can also visit our website, www.promedical.continuouscare.io. You can open a file as well. It works the same like the 066 number. The only difference is that this one, you actually punch in the website address and then get to the website directly, not via WhatsApp. Then open a file. Once you have done that, you can then download our app. If you are on our website, you just scroll down on our bottom right, you'll find the app icon. Click the app icon, and then you download the app. Once you have the app, you can then use the app to consult. And the good thing, you can consult anytime, anywhere, 24 hours. And it's cheap. It's only 100 rands. And I guess this is actually something that many people would actually love. We also deliver prescriptions, medicines, and medical certificates. Anything can be done. These days, we don't run short of ways and means of actually making sure that you get what you need. We provide home-based care, and also we do house calls. This is exciting because most of the people who need help from home, who cannot visit doctors' rooms because of transport issues and so forth, we can always visit them there at home. And then there's a call-out fee depending on the distance because it's calculated at per kilometer rate. And then also at the time, what time is it at night or is in the morning or afternoon, where you also pay, a person will also pay for the medicine separately and any other consumable that a person may need or any other thing that may need. But it's good because usually it's not expensive, it's affordable. This is one area where we felt that we need to give something to the people, to the society, to the communities. Make it affordable, because if it's not affordable, then it's as good as it doesn't exist. We're available 24 hours. And if, for instance, there's an emergency, we take your WhatsApps only on this number, 081 321 1534. Please, guys, like the video. It encourages us when you click because it gives us a feedback. We know if you like it or you don't like it, even if it's negative, you don't like it, and then it helps us because then we know that we need to improve our presentations, how our videos look like, and subscribe. If you subscribe, it assists us a lot because you encourage us to do more videos, and we know that there are people who are going to consume this content. So at least you give us an indication when you subscribe that at least there is a person out there who is interested in our content, and share it with any other person that you know, people that you know in your network or in your circle of friends. And comment for us is very, very important because at least we know what you are thinking of the video. You can also request that we discuss other conditions maybe that we have not covered, or that you feel that are so important that you want us to cover them quickly. We can always do that. Or maybe something that is bothering from you, you don't know how to deal with it, or we have seen many doctors before and they are not getting any help. Or we have been to hospitals. We are so frustrated and you want us to talk about this thing, how we can get help and so forth. So guys, please, we are available. We are out here to help you. Like the video, subscribe, share, and comment. Very, very important. And thank you very much for watching this video. I really, really appreciate it. And I hope that you are going to make use of my online services, my online consultation. I'm doing this for you guys. I know that it's so difficult to get information. Medical information is medical terms are very technical. I'm going to try and make things easy for you. Make these videos easy to understand so that you can share the information with your loved ones and let us stay healthy. Thank you very much.